my name is Sarah Lopez-Hidalgo. I am finishing my master's in nursing education at Western Governors University. This is my nursing education capstone project, C822 Task 2. So we're gonna go ahead and get started. My introduction is I'm assessing the gap in education for new graduate nurses that lack knowledge, confidence, and experience. And the gap that I've seemed to assess is caused by inconsistency in exposure, inconsistency in the volume of patients in the hospital, or the acuity of patients that the nursing instructors have no control over, as well as staffing. We all know that typically in the summer, the census gets lower and the acuity gets lower, and then in the winter, the census gets higher and the acuity gets higher. So sometimes a nursing student could be paired with a nurse that only has 1 or 2 patients waiting on admissions, but then definitely limits the exposure for that nursing student. And also the students have a very limited number of clinical hours. They're exposed to clinic once every week for about 12 hours, but as soon as like JACO walks in the door or anything, they typically send the nursing students home, thus limiting their clinical hours even more. I know personally at Huntington, we are under construction, so a lot of our units are also closed, thus limiting how many students we can have and how many patients we have those students can take care of, just because there's not as many open beds right now in the hospital. So the purpose of my curriculum and assessing this gap is to help close the gap and provide additional education to the students through simulation so that they can get that hands-on experience, even if they're unable to get the experience in the hospital. So the gap I addressed, like I mentioned, was at Huntington Hospital, specifically with Pasadena City College students. So like I said, the inconsistent exposure and clinical hours, if they very limited amount of clinical hours, were unable to control the volume of the number of patients coming into the hospital, thus possibly limiting the student working with a nurse with only 1 or 2 patients instead of a full load. And then also we can never control the acuity of the patient. So the students can be exposed to patients, but they may be very stable patients. So limiting their exposure experience, as well as staffing challenges. If they are short, then they only have, like if they don't have enough patients, then the staff is limited. Then the students may or may not all get to work with a nurse, depending on how many patients are there. Just some of the education that I have found that has some evidence-based practice associated with this is lack of clinical time, skill deficiency, and lack of confidence in new graduate nurses. It's imperative we create a supportive environment in which novice and new grad nurses are given time to adjust to their new role and gain confidence while working autonomously. And then lastly, for instance, the expertise of the simulation were perceived to transfer to practice, serve as a sound basis for clinical judgment, and enable communication with patients and their relatives. So here's just 3 evidence-based literature reviews of how there is a deficiency and a lack of confidence in our new nurses, and how simulations were able to come into practice and be utilized as students brought that practice into their practice as a nurse and brought those skills onto the floor. So our current practice is the students go to clinical once a week. They have a limited number of hours that they're available for the students to go to, and limited clinical sites. Not all hospitals can take nursing students, not all units take nursing students. So being able to get your students into a facility, into a unit, is sometimes very challenging, thus limiting what we can expose our students to if we can't even get them in there. So the connection between the gap and the literature, as I have assessed the gap, the literature we discussed previously shows great examples of multiple peer-reviewed sources on simulations being incorporated into the curriculum to assist in closing the gap. By providing a simulation, we are in a controlled environment that we can control what the students are exposed to. So verifying the students are exposed to critical situations, the students are exposed to codes, the students are exposed to know when to call the doctor, how to communicate with the code team. All these essential nursing skills that we need to verify that the students have before going into practice, whether they were able to actually be exposed to it in clinical or not, is sometimes challenging. So we'd like to make that consistent across the board to at least verify the exposure of some critical situations for these students to learn. As we continue with the connection, the new graduate nurses who received simulation-based training showed significantly higher clinical competence. Being placed in a critical situation can be overwhelming. It can cause you to be nervous. It can cause you to forget things. And that's something that we learn as nurses to control over time and over experience. And these students not having any makes it very challenging for them in that situation to be learning and doing it for the very first time. So as long as we can incorporate some simulation, that will at least transfer into their clinical practice. Overall, we see consistent evidence that the stimulation scenarios that include various clinical settings should be developed to enable new graduate nurses to adjust to the clinical setting. It's a big adjustment to be a nursing student to a real nurse. There's a huge gap in education. As we continue to work to close that gap, will help in patient care outcomes, nursing being more comfortable, new graduate nurses, and just better outcomes overall for the nurses as well as for the patients. So some of the steps in getting this curriculum started, we're gonna have to collaborate as a team to develop a detailed plan and timeline of finances, of staffing, of hiring, with the College Board of Nursing, as well as with the Pasadena City College Board in general. We're gonna have to assess and discuss the evidence-based literature so that we can verify what scenarios would be best, how we should go about this, and what would be the most accurate evidence-based practice to educate our students with. We're going to have to collaborate with the college, specifically on finances, how are we going to fund this project, how are we going to fund all the necessary requirements, the simulation lab, the mannequins, the additional staff. Where is this going to be located? Do they already have a building? Do we need to build a building? And the college support is going to be necessary to make this a long-term goal for sure. Then as a nursing staff, we're gonna have to compile the evidence-based research and determine a detailed plan of the curriculum. What are we gonna expose the students to, which order, how would be the best to go about it, and come up with a detailed curriculum plan for the students. And then of course, we're gonna have to implement the course. So implementing it into our nursing program so that the students will be exposed and be able to use this curriculum to help close the gap. So lesson topics. In this course, the students will be placed in a code situation. They will learn to delegate, communicate, administer medication, bag patients, CPR, apply all their critical thinking skills. So by the end of this course, they will be able to gain knowledge and confidence and expertise that they can bring into their clinical practice. We all know that as novice nurses, you're not always knowing what to do in a code situation. What should we do first? What would be best for this patient? Why is this patient coding? What should we anticipate? So those are all things that I would like to, the goal of this curriculum would be to educate those novice nurses so that they are a little bit more prepared in all those situations and that they're feeling comfortable. They've never done CPR, feel comfortable practicing CPR, practicing bagging patients, practicing drawing up those medications and administering them during this sometimes hectic situation. Being able to accurately communicate. This is what I received in report. This is how the patient presented. This is what's going on currently with the patient, and this is what I think is wrong. As a novice nurse, sometimes you don't know. Even as a old nurse, you sometimes don't know why this happened or what is going on. Sure, we have some speculations, But learning all that critical thinking that quickly can be very difficult in a very pressured situation where you're not sure which is important to communicate, which is not important to communicate. Who are we communicating with? Our RTs, our other nurses on the floor, our charge nurse, our doctor, who comes to the code. All these things will be discussed in this curriculum. Some additional learning objectives. By the end of this course, the student will be able to demonstrate how to actually collaborate with their team competently. So who's on your team? How do you collaborate? What's pertinent to that team member? What is that team member qualified to do? What are their roles and responsibilities? And what do I need to communicate as a nurse to them? By the end of this course, the students will accurately demonstrate when is appropriate to call the doctor. Definitely as a novice nurse, it's scary to call a doctor. You're not sure, when do I call the doctor? Should I call the doctor for this? Should I not call the doctor for this? So really educating the students, like, these are the orders that I have. This is what's going on with the patient. This is what I've done as a nurse and my nursing interventions to aid this patient. And you know what? Let me call the doctor. My interventions aren't working. I need to call the doctor. This is what I say to the doctor. These are my recommendations for the doctor and what's going on with this patient right now. So all those. By the end of this course, the students will accurately perform calling a code rapid response. The students need to be aware when it's appropriate to call the doctor for additional help or resources, or when they need to just call a code, whether it be a code rapid response or a code blue. But there's definitely a difference, and I don't want the students to ever doubt themselves or doubt their knowledge of when to do which. So definitely being able to clarify, at this ABC, this is when I should really call the doctor. ABC, this is when I really should just call a code because I need something immediately. By the end of the course, the students will accurately demonstrate communication such as bedside report to the code team when they have done, what their thoughts are as a primary nurse. So kind of similar, but what have I done? What was the report I got as a nurse? What has changed? What are we thinking? What needs to be done? What do I need help with? Being able to communicate with all your team members. So some teaching strategies to do this. The student will begin observing an educational video of a code done well. They'll see the roles, the responsibilities, the communication, the skills, the tasks that the doctors use, that the respiratory therapist use, that the nurse uses, how to chart, all these different roles of people who show up to a code, who comes to a code that they can communicate with and observe. Once the student observes the video, then they're going to practice a similar role play with 3 to 4 nursing students, kind of go over a little bit of, okay, assigning roles, communicating who's in charge of what and why. After that, the students will be placed in a simulation role as a group, and they will be given a new scenario. The mannequins will move, they will talk, they will have bodily fluids, and based on the student's response will be obviously based on the mannequin's response. So if the students are doing well, the mannequin will start to get better. If the students are not doing well, the mannequin will die. So all these learning situations so that the students have observed one, they have discussed one, they have done one, and at the end of that, we'll collaborate as a team and assess what did we do well, what did the students do well, what did they not do well, where can we improve on, so that they know their own strengths and weaknesses coming out of the simulation, and then they can thus far learn from their mistakes in a safe environment where nobody's able to get hurt and they can just feel comfortable in learning. The required materials that the students are going to be needing to have prior to taking this course will be their BLS card from the American Heart Association, and they'll also need their ACLS card from the American Heart Association. So both of those certifications will be required prior to us taking the simulation course for the students. Some learning outcomes that we would expect to observe the students that they have successfully been able to improve their hands-on care in their clinical settings. As a clinical instructor, I would anticipate to assess improved skills, improved confidence, improved communication after this course in their day-to-day clinical as well as, of course, in any type of critical or code situation. I would also expect, like, as the students moved on in the course would become more difficult. And I would expect them in clinical that the students would go and assist during a code situation, that they would use their critical thinking skills, that they would assess what's going on with the patient, what have they done with the patient, what do they think is wrong with the patient. I would also expect the students in just their normal patients to be able to further assess, this was my head to toe assessment, this is the lab work that I've determined, like, for this patient, this is what's going on with this patient. As a nurse, these are my nursing interventions and how I can better assist this patient, and this is the plan of care for this patient. So I want the students to also be able to look at a well-rounded view of each of their patients. So as a clinical and professor, you would observe students being more hands-on, implementing additional critical thinking, that they wouldn't shy away from code or difficult situations, that they would try and really take those on and be proactive and facilitate their skills. So lesson plan details. By the end of the course, the students will be expected to demonstrate accurate collaboration with their team. They will be professional communications. They will identify who's on their team. They'll identify what that team member needs to know and how to best communicate clearly. Also, when they're receiving a report, I want the students to identify what specific questions do they need to know about this patient. Is this a respiratory patient? Is this a cardiac patient? What's going on with this patient? And do I need to know anything specific about this patient? By the end of this course, the students will accurately demonstrate when it's appropriate to call the doctor. When is it appropriate to call the doctor versus calling a code? I would like them to practice calling a doctor. Hi, Dr. John, this is Mary Jane calling from 4 West about Mr. John Doe. This is what is going on with this patient. This is what I've done with this patient. These are my recommendations. What are your thoughts? Trying to get orders for patients, or just trying to be confident in calling a doctor. I know as a novice nurse, it can be scary to call the doctor, to know when to call the doctor, to know what to say, and not become flustered. So I really want the students to be confident in that. By the end of the course, the students will accurately perform calling a code rapid response. Similar, as a new nurse, you get very flustered, a lot of things going on at one time. I want them to be confident in knowing, when is it time to call a rapid response? When is it time to call a code? When do you not have time to wait for a doctor, to wait for somebody to call you back, to wait for orders? When is this patient's condition getting too critical? And kind of maybe what are some things as nurses you can implement prior to? What else can you try before this? By the end of the course, the student will accurately demonstrate communication, such as bedside report, giving a report to the code team, what they have done, what their thoughts are as a primary nurse. Communication is key in healthcare and nursing specifically. The nurse, you communicate with everybody. You communicate with respiratory, you communicate with your other nurses, you communicate with your charge nurse, you communicate with your doctors, with your family, with your physical therapist, with your dietitian. Everybody is wanting to talk to you. So really knowing what that team member needs, what that team member needs to communicate, what you can do, really helps everybody. But overall, learning how to communicate well will help the better outcome of your patient. So success methods. After the curriculum's done, we're going to plan on doing a survey, an anonymous survey for the students, so that they are able to write down what they thought was good, what they thought was bad about the curriculum, where can we improve as a school performing the curriculum. We'll also continually observe students as they progress in their journey of becoming a nurse. What have they learned? We're going to need feedback from the clinical instructors, feedback from the lecture instructors, kind of feedback from all the nursing instructors that are involved with these students. And then once we have all the feedback, we can collaborate as a team and determine what have we done good, what have we done bad, and what should we change. And then we can observe those outcomes continually. We're going to have to make sure everything is up to date with evidence-based practice. So a lot of moving parts, but always continuing to improve to make sure we're doing the best and we can educate these students. Decision-making process will be determined on the surveys and the feedback that we've received. Once we've gotten those, we'll be able to collaborate as a team to determine, is this evidence-based? Should we change this? Should we not change this? And how can we change this? So a lot of collaboration, communication, and well-rounded feedback will determine decision-making process as far as what will be best for the students and their overall outcomes. The success will be observed by students at their clinical site. How are they performing? Their communication with the doctor and their team. And observe students in code situations. Success would be that students are collaborating with their team well. They know when to call the doctor. They know when not to. They know when to call a rapid response. They know who's part of their team. They know they're feeling more confident at clinical. They have more experience, and that they're really able to facilitate some of this for themselves and for their patients, especially learning how to facilitate all these things for their patients. Definitely going to be a lot of challenges in starting a new curriculum. It's extremely time consuming. It's time consuming to make the curriculum, to set up all these meetings, to collaborate with everybody. It's going to take a lot of time. It's also very expensive. The mannequins, the supplies, the simulation lab, thousands of dollars. So finances is always going to be a struggle. We're going to need supplies. The students, we want them to really start IVs, really administer medication, really practice these skills and hone in on them. So supplies, that stuff isn't cheap either. That stuff is all very expensive. And of course, if one thing gets delayed, if one meeting gets delayed, if one observation gets delayed, it's going to be a snowball effect in delaying the start of the curriculum. So really just trying to stay on schedule as best as possible and anticipate where things may be delayed and how we can help prevent that. So the organization short-term plan will definitely have to front a lot of money to financially invest into the students' education to start this curriculum. So finances will be a big thing from the college, from the nursing program, the college board support. This isn't going to happen with just the nursing program. Sure, the nursing program is going to be the one who's taking on most of this, but without the college support and during this process, it will not happen. So, and we're also going to need a lot of staff. We're going to need maintenance staff, IT staff. Somebody's going to be in charge of these mannequins, moving the mannequins. We're going to need another full-time nursing instructor to run this course. So a lot of additional staff will need to be interviewed, hired to collaborate with and educate. So some of the long-term goals is also similar things, funding. These mannequins and this simulation lab and the supplies needs to be maintained. So we're going to need financial support from the college, from donations, however we can to really get the support to continue this curriculum even after starting it, as well as maintaining staff. Staff is going to have to do continual education for evidence-based practice to make sure that this curriculum is up to date and accurate in the most effective way we can educate these students. And then constant research in the evidence base. So we're going to need full-time staff for the simulation lab, full-time staff for the curriculum, full-time IT, full-time maintenance to help really make this curriculum continue. So just some of the resources that we're going to need, of course, is finances and money. The staff, we're going to have to hire additional staff to make this happen. We're going to need a full-time IT person there. Full-time lab with supplies and continual research so that we can make sure that everything is up to date and evidence-based for these students. So the MSN outlined the two that I believe that this curriculum outlined the most was first, provide oversight and guidance in the integration of technology to manage care, identify performance measures and standards that improve quality and safety outcomes. So the simulation lab is all going to be pure new technology that we're incorporating to help nursing students learn how to identify and manage care to overall be safe and have positive outcomes. So I think that this MSN outcome very much aligns with this curriculum, just in all of those aspects. The second one is employing appropriate patient care technologies and information management strategies to improve quality care. So we're using technology to help improve patient care, to help improve the students to learn how to manage their patient care. So without this state-of-the-art technology, this would not be possible. So technology definitely has a big role in this new curriculum and utilizing it well. These are some of the sources that I cited that I used in this presentation. Thank you.